In my other shoe, I'm gonna stick my meds just in case I get a little vertigo.
Cooper talked about having vertigo, so let's talk about it. BPPV actually stands for benign paroxysmal positional vertigo. If you ever need a tongue twister, there you go. So we have a system in our inner ear called our vestibular system, but it consists of a lot of different little bones and canals and whatnot. So with vertigo, true vertigo is the crystals in your inner ear getting dislodged from certain areas of the inner ear that go into these canals and then cause that disequilibrium and like the world is spinning around you. So yes, it actually is little crystals in our ears. We call them otoconia, but we just call them crystals. There are a lot of things that can cause vertigo: car accidents, any type of like head shaking or trauma, and neck pain and like mobility issues in your neck can actually also contribute to it. A lot of the times what I see when I treat vertigo is there's other things going on, and usually neck pain is a part of it. So usually I am treating them together. And yes, physical therapists treat vertigo by doing a bunch of different things. There are different maneuvers we use depending on what canal is affected. There are certain canals that are more dominant and common compared to ones that are more rare. But we get trained on evaluating and determining what direction and canals are being affected. Another thing I will say is the medication, usually they are going to give you meclizine, and a lot of the times meclizine is not actually treating you, it's just masking the symptoms that is making you feel dizzy. So it's great, if you need a little quick pharmaceutical help because you need to get through something and you just can't be dizzy and like get through your day. But a lot of times vertigo can actually go away on its own within 2 weeks. But like I said, it can happen again. It is reoccurring, can be reoccurring. Sometimes if you do get vertigo once, you are way more likely to get it again, and it can be reoccurring if certain factors are not addressed. But like I said, the medication is not going to treat it and is not the end all be all, but there is physical therapy that you can do for it. So for anyone who is listening that may be experiencing vertigo, has a family member or friend that gets it, you should go see a physical therapist and go get a script from your primary care doctor to go to physical therapy for vertigo and dizziness. I'm assuming Alex Cooper has a team and already knows this, but if she doesn't, I hope that someone in her circle tells her to get physical therapy for this, especially if it's reoccurring, because they could do some quick maneuvers, do some quick testing to see if there's actually other vestibular dysfunction in the inner ear going on. What other questions you have about vertigo? Because I actually love treating it. It is so fun and so just random, It's something you don't think physical therapists treat until you get it and get seen for it. So the more you know.